Om Swastiastu. Hello, doctors and friends. My name is Nandhita Naaz with the last three digits of Students ID 115. Now I'm going to start our presentation about the differences in health-related quality of life between younger and older adults and its associated factors in patients with type 2 diabetes mellitus in Indonesia. So these are the members of the SGD B10. And now I'm going to continue with the first chapter, which is the introduction. So diabetes mellitus is a growing global health concern, with Indonesia experiencing a sharp increase in prevalence between 2019 and 2021. This alarming trend underscores the need of effective interventions. A critical aspect of diabetes management is understanding its impact on health-related quality of life, or the HRQOL, which encompasses social, physical, psychological well-being. The student project will focus on how several factors influence the HRQOL among younger adults and the older adults with type 2 diabetes in Indonesia. These are the problem formulations for this article, and these are the objectives for this article. And for the benefits, the first one is to give general and specific information about type 2 diabetes mellitus, including its definition, determinants, natural history, relation to occupational disease, study design, data analysis and presentation, source bias, potential outbreak, surveillance system, screening method, and relevance to disease prevention in community. And second one is to disclose the study on health-related quality of life in type 2 diabetes mellitus patient. That's all from me. The next one will be continued by my friend. Thank you.
Hello, now we will explain about the chapter 2. Before that, let me introduce myself. My name is Amanda Devasha and my last three digits of student number is 068. Now I will explain about the determinants of type 2 diabetes mellitus. Determinants of disease are characteristics that are found in the population. In the student project, we use the epidemiologic triad model. This model uses a three-point approach, namely the host, the agent, and the environment. According to this model, if these 3 points are in balance, then a disease can occur in our population. Based in this model, we can conclude that there is a relationship between the host, the agent, and the environment. Intrinsic factors include the age, sex, lifestyle choices, and obesity. Older adults, particularly those over 60, generally experience a lower quality of life compared to the younger individuals. Gender differences were also explored, but the study particularly noted that age had a more significant impact on quality of life, as older patients have reduced physical functioning and increased the emotional burdens. The development of type 2 diabetes mellitus typically involve a combination of insulin resistance and beta cell dysfunction as an agent in this model. In the socioeconomic variable, such as income level and education, are essential determinants of health outcome in type 2 diabetes mellitus patients. Patients with higher income and education level tend to manage their diabetes better, as they often have a greater access to healthcare and more awareness of disease management practice. The relationship between type 2 diabetes mellitus and climate change involving the direct and indirect effects. The example of direct effects are temperature extremes and air pollution, and the example of indirect effects are access to healthcare, lifestyle change, and also the infectious disease. Maybe that's all from me. Thank you.
Hello, my name is Anak, Agung, Kirana, Dharmautami, and the last digit of my student number is 133. So I'll be presenting about the natural history of type 2 diabetes. Now, there are three main risk factors that contribute in the pathogenesis of type 2 diabetes, which are genetic, environmental, and metabolic factors. But I would really like to hype the environmental factor because this is what has changed. The trend has changed over the past years in our population, because nowadays most of our lifestyles are more associated with being sedentary and also having low physical activity, and this is furthermore associated with obesity, which has increased in our population over the past few years. Now, obesity, it's one of the most common underlying conditions associated with type 2 diabetes because it affects the metabolic factors and triggers genetic factors to develop this disease. In patients with obesity, they have a higher level of adipocytes in their body, meaning that when inflammation occurs, it occurs in a very massive and systemic rate, in which this leads to chronic systemic inflammation and results in insulin resistance, either because the cells no longer responds to the insulin, or because the beta cells of the pancreas no longer produces adequate insulin for the body. This is the natural history of type 2 diabetes, the stages that occur in the body. There's prediabetes, diabetes, and complications. Many studies have shown that the first 10 years of the development of diabetes in the body is the best time to prevent it from going into absolute insulin resistance, which we all know as type 2 diabetes itself. Now, if the disease cannot be prevented and complications occur, the most common complications that may occur are cardiovascular related complications, such as heart attacks and acute coronary syndromes. That is it for me. Thank you.
My name is Ajani Sedina Pakpahan with student number 031, and I would like to continue the presentation about type 2 diabetes mellitus as occupational related disease. Type 2 diabetes linked to work environments is becoming more common due to increases in obesity and physical inactivity, especially in sedentary job settings. Technological advancements and remote work are reducing physical activity, which increases diabetes risk. High-risk occupations, for example, manufacturing, driving, shift work, are more likely to experience diabetes due to long sitting hours, stress, and disrupted sleep. Effective multi-component interventions, for example, education, dietary changes, physical activity, at workplaces can reduce diabetes risk and improve health outcomes. But long-term research is needed to evaluate their sustainability and impact. I think that is all from me. The presentation will be continued by my friends. Thank you.
Om Swastiastu. Hello, doctor and everyone. My name is Erick Gonata with 3 digit of my student ID is 096. I will continue the presentation about the interpretation of size and number calculations in the study on health-related quality of life in type 2 diabetes mellitus patients. So for the interpretation of size and number calculation itself, in this article, there are several key numbers presented, each number representing different types of data to describe the study's result. The first one, we got mean and standard deviation. Mean is a central tendency measure. It means it is the average of something, some data. In this case, we got the average of older adults being 70.00 years. This can be calculated by summing all values and then divided by the total number of the people. Moreover, the standard deviation itself shows the variation in the age. In this case, we got 4.60 years. It means that the mean of the data is spreading from 70.00 minus 4.60 until 70.00 plus 4.60 years. And then the second one, we got percentage. The percentage itself shows the proportion of something. In the article, we got 70.87% of older adults are female. This indicates the proportion of females in the group of older adults. It is calculated by dividing the number of females by the total older adults and multiplying it by 100. And then the third one, we got p-values. The p-values test the statistical significance of the result. In the article itself, we got 0.032 p-value for level of education differences. And for the result itself, if a p-value is lesser than 0.05, it means it indicates a significant difference between group. And for this case, it means there are significant difference between level of education differences. And then for the last one, we got adjusted R square. The adjusted R square, in this case, we got 0.321 in older adults. It comes from regression analysis and indicates that 32.1% of the variation in quality of life is explained by the predictors. This helps us to understand how well the model fits the data. The next presentation will be presented by my colleague. Thank you.
Okay, first of all, let me introduce myself. My name is Fransiskus Asisi Tokan with the three last digit of my student number is 092. Okay, so here I'm about to talk about the research design and also method that used in the study on health-related quality of life or HRQOL in type 2 diabetes mellitus patients. So this study has an aim to determine to compare the HRQOL between younger and also older adult with type 2 diabetes mellitus in Indonesia. And this study uses simple random sampling from 641 patients selected from 16 primary health centers, which is suitable for the study because every patient has the same chance to be picked and minimizing the bias. And also, this study excludes patients with physical disabilities, cognitive or neurological impairment, and also advanced complication to enhance the validity of the study. And also, this study use cross-sectional design, which fits to help interpreting the prevalence and also the differences at a single point in time. However, this study does not include any intervention or studying about specific intervention to improve the HRQOL in type 2 diabetes mellitus patient. But However, this study can also help to raise awareness and also identifying targets for specific interventions to improve the HRQL in type 2 diabetes mellitus patients. Maybe that's all from me. Thank you.
My name is Yovilia Tio Yunus and my last three digits of student number is 035. Now I will explain about data analysis and presentation in the study on health-related quality of life in type 2 diabetes mellitus patients. The data analysis and presentation in this journal are methodologically sound and appropriate for the study's objectives. The study uses a structured data analysis approach, starting with descriptive statistics to summarize characteristics of 641 type 2 diabetes mellitus patients. Independent t-tests and chi-square tests assess statistical significance for continuous and categorical variables. Hierarchical multiple regression identifies predictors of health-related quality of life, showing that education and employment influence younger adults, while depression and income are more important for older adults. The models are validated through multicollinearity testing, confirming reliable findings. Data is clearly presented with tables that effectively summarize demographic and regression results, highlighting differences between age groups. The study compares its finding with previous research, offering insight into unique health-related quality of life predictors in Indonesia. That's all from me. Thank you.
My name is Nandhita Naaz with the last digit of student number 189. Now I'll be explaining potential sources of bias in a recent study on health-related quality of life in type 2 diabetes mellitus patients in Indonesia. Our analysis has identified several key areas of concern. First, selection bias may have occurred due to the study's limited scope and exclusion criteria. Second, recall bias is a factor as the study heavily relied on self-reported data. Cultural bias is also present, with Western developed instruments being used in an Indonesian context. The study's cross-sectional design limits our ability to establish causality, while measurement bias may arise from simplified scoring systems, and additionally, the focus on a single regency in Indonesia raises questions about the study's generalizability.
Swastiastu, doctors and friends. My name is Fiona Aurelia with the last three digits of my student number are 125. Next, I'm going to talk about the potential outbreak and responses towards the type 2 diabetes mellitus. In this part, the explanation will be done chronologically. First, increasing type 2 diabetes cases. The prevalence of type 2 diabetes is rising globally, especially in developing countries, and this is driven by lifestyle changes and worsening health related quality of life, or HRQOL. Next, demographic factors. Income, education, occupation, and especially age are significant contributors to the type 2 diabetes outbreak, with older adults being at greater risk. Next, type 2 diabetes in older adults. A study by Beller et al. In 2021 shows that older adults have a higher risk of hyperglycemia due to physical and cognitive decline and comorbidities. The number of adults with type 2 diabetes is projected to rise from 122 million to 253 million by 2045. Type 2 diabetes in younger populations. Type 2 diabetes is also increasingly diagnosed in younger adults and adolescents, with worse risk factors like higher body mass index and unhealthy diets. Type 2 diabetes, diagnosed at an early age, results in more severe outcomes. Next is the impact on HRQOL. Type 2 diabetes, especially older adults, often experience poor HRQOL due to pain, discomfort, frailty, and other life challenges. And for the response, the first one is type 2 diabetes management. Effective treatment focus on glycemic control, non-pharmacological approaches like health education on diet, exercise, and regular checkups. Lastly is pharmacotherapy. Pharmacological treatments can be given to people with type 2 diabetes, but this require careful management to avoid adverse effects. That is all from me. The presentation will be continued by my friend. Thank you. My name is Kamang Wahyu Widya Santi Sutama with the last digit of my student ID number is 086, and now I'm going to talk about surveillance system of type 2 diabetes mellitus. Surveillance systems for type 2 diabetes mellitus are critical in monitoring, preventing, and managing this widespread condition. Effective surveillance involves the systematic collection, analysis, and dissemination of data, helping to identify trends and assess the success of diabetes management programs. Over the past decade, the global prevalence of type 2 diabetes mellitus increased rapidly, highlighting the urgent need for more effective surveillance systems. Unfortunately, many low and middle income countries face challenges such as limited data availability, particularly on type 2 diabetes mellitus complications complications which hinder the development of effective healthcare policy. To address this, there is a growing need for population-level registry linked to hospital data. In Indonesia, improving type 2 diabetes mellitus surveillance is a priority. Developing population-based registry, standardizing diagnosis and complication reporting, and enhancing data management will ensure more accurate trend analysis. This is especially important for monitoring disparity in the quality life between the younger and older adults with diabetes. Incorporating the surveillance data into policies can lead to better educational and preventive programs. The NICE surveillance framework emphasizes on two-phase approach. The first one is risk assessment and then confirmatory blood tests with a focus on personalized lifestyle interventions such as diet and also medication. That's all from me. Thank you.
My name is Gede Diva Dhananjaya. The three last digit of my student ID is 075. Now, I would like to cover briefly about screening method of type 2 diabetes mellitus. I picked this reference from American Diabetes Association in 2002. So there are two common methods for screening. The first one is the common one or the practical or the most cheaper one, which is fasting plasma glucose test. So in this method, it requires a subject that being in fasting condition minimal within 8 hours before test. The result interpretation is when the FPG shows value from that within 110 until 125 milligram per deciliter of blood is indicating an impaired fasting glucose condition. And then, in the results exceeding 126 milligram per deciliter of blood, it's indicating diabetes. And the second method is oral glucose tolerance test or OGTT that requires a subject given 75 milligram of glucose via oral, and then the test or the glucose level being tested 2 hours later. The result interpretation of the test is when the OGTT value shows over 200 milligram per deciliter of blood, this indicate a diabetes condition. So these are two methods that I cover. The next topic will be covered by my colleague.
My name is Dea with trilogy number 129, and I will explain about the relevance to control and prevention effort in community. While the conclusion of this article might not directly inform disease prevention and control effort, they may contribute to a better understanding of the health outcomes associated with type 2 diabetes mellitus. The objective of preventive diabetes care in the community is to target those communities at high risk of experiencing a poor quality of life in the event of developing diabetes. This approach is designed to reduce the prevalence of serious complications. The prevention of diabetes-related complication is important to improve patient health-related quality of life. This requires ongoing medical care that focuses on more than just blood sugar control. It's recommended that diabetes programs should be designed with a focus on promoting self-management, addressing diabetes distress, and providing optimal family support. Health education programs have the potential to mitigate the impact of diabetes on population health and enhance quality of life by prioritizing prevention and management strategies. Patients with higher education levels may have better treatment adherence and health-related quality of life due to their positive outlook on health, understanding of the disease, treatment plans, potential outcome, and greater attention to treatment and nutrition.
Hello, doctors and friends. Let me reintroduce myself. My name is Stanislaus with the last three digits of student's ID 115. I'm going to continue the presentation with the last chapter, or chapter 3, summary. So the conclusion for this study is that the rise of diabetes mellitus in Indonesia and globally needs urgent interventions, particularly on its impact on the HRQOL for all age groups. A recent cross-sectional study involving 641 patients highlighted the significant differences in HRQOL based on demographic influences, with older adults experiencing worse outcomes due to comorbidities. Effective treatment focuses on glycemic control and lifestyle changes, while improved surveillance and community-based efforts are essential for early detection and better disease management. And for the recommendation that we can propose based on the study is that to enhance the surveillance and data collection for timely detection through several methods. Next one is education and self-management. Next one is lifestyle modifications, effective glycemic control, addressing socioeconomic disparities for coping with psychological impacts on T2 diabetes mellitus, doing research and monitoring that can improve the HRQOL, and overall disease management. Okay, so that's all for the presentation from the SGD B10. Thank you for listening.